Good afternoon. The COVID pandemic is still going on, but other health conditions are still an important part of our overall health and wellness landscape. We're here to talk about all that, plus air pollutions, on today's episode of Doc and Dean. Welcome, Doc. How are you?
I'm good, man. I'm good. I'll tell you, I'm much better than President Biden. He had a pretty bad. I've never seen a president with a worse week than this. And the reason I mention it because one of the big things that happened to him, among a number of things, is that the Supreme Court said that he couldn't mandate, masks and vaccinations in businesses. You know, the rationale was that there was not their role. Can you now? This is it. Clarence Thomas, enough said. Clarence Thomas said that, it wasn't the business of the Supreme Court to look at the implications of the outcomes of their decisions as it relates to the 1,700 people who die every day in this country. I think one of the things that I'm seeing in my own practice, Mr. Dean, is hundreds of children and adults being infected by the Omicron variant. Fortunately, there may be a good side in this, in that a lot of them, most of them are not that sick.
Mhm.
And so consequently, after 5 days, they can kind of roll right on back into a regular lifespan. But I think we should discuss a scenario. And let me just ask you some questions as a patient. All right. Okay, I'm a patient, and I was just told that my cousin, I told him not to come over anyway, came over to my house, and we had a conversation, and he was positive.
Excuse me. Yeah.
You okay there? He was positive. So now what do I do? I'm fully vaccinated, and I had my booster.
Mhm.
So, there are three things. I'm a contact, definitely, because the definition of contact is someone who is within a positive range 6 feet of a positive person for more than 15 minutes.
Right.
But I'm boosted. So what do I do?
I would say you should self-quarantine and test.
All right. So I take the test, and my test is positive.
Okay.
Okay. And the test from my unvaccinated other cousin who won't leave my house, still living here, he's not been vaccinated. So first of all, what do I do if I have a positive test? I'm vaccinated.
Quarantine and mask, right? So you should quarantine yourself, and you should wear a mask.
I don't have to isolate if I have a positive test.
Well, that's what I mean by quarantine. Yeah.
No, there's two different terms now. There's
Isolate.
quarantine and there's isolation. Quarantine means that you can walk around and do stuff until you get your test result. And unless there are two conditions where you don't have to quarantine. One is if you've been fully vaccinated and boosted. The other is if you've had COVID within 90 days. So you won't have to quarantine. But the rest of it will have to quarantine. If you're positive, now you have to start to isolate, which means you have to get away from everybody else, both you and your cousin. Because
Yeah, absolutely. I mean, if you have a positive test, you need to be away from people as much as possible.
you have to isolate.
Isolate.
I'm not trying to be difficult. But the term quarantine and isolate are basically two fundamentally different positions. But once you're isolated, how long do I stay isolated?
Well, it depends on what you ask the CDC, right? The CDC is now recommending 5 days for asymptomatic isolation,
Right.
where it down from 10 days.
Right.
And that is just due to the typical, and I'm going to say typical course of the Omicron variant. Now,
Right.
despite having, there's a general belief that the Omicron variant is milder in terms of milder symptoms. If you ask people that are in the hospital and seeing how many beds are taken, and they're saying that the number of hospitalizations with regards to COVID cases are higher than they were last year when the Delta variant was the prevailing variant, then it would suggest that Omicron is not just as safe as people think it is, and they think it's okay just to go ahead and get it and ride through it. But again, I think it's ultimately what the mindset has to be. And I was on a call with the White House yesterday, and all these big, powerful people with all these wonderful titles, and there was little old me there, and I got the most head when I said, "You have to keep the messaging simple. We're making it."
Wait, let me go back. You were on with the White House?
I was on with the White House.
Were you representing somebody? I mean, what?
I was representing BlackDoctor.org. I was representing the organization. Because we are an essential partner with regards to.
Did they have you on the screen with the president and everything?
Not the president. The president was on there. I'm not talking about the president. I'm talking about the people that are handling COVID. And this was specifically for getting how to get the messaging out to the Black community. So NMA president was on there, the president of the American Psychiatric Association was on there, National Black Nursing Association was on there. Folks, and little me.
Here's my question, and here's what bothers me. I understand exactly what you say is true, is that the CDC said 5 days. All right, now my cousin's still symptomatic, so he goes another 10. Gets tested, he's still positive, he's symptomatic, he goes 10. At the end of 5 days, I'm asymptomatic, or he's asymptomatic. Do I get a test before I leave isolation?
I would say yes.
But you don't have to on the CDC site. They say you can walk away.
Here's the deal. And this is what I was saying yesterday on the call, was now as a people, we have had a kind of a general and very, very real distrust of government. We have a general and very, very real distrust of healthcare. We can't pick and choose when we want to engage with that. Oh, we're going to follow the rules now, because in terms of, are you following the rules with your follow-up when your doctor says you're supposed to do this? Are you following? So there's a myriad of things. So we can't pick and choose when we want to follow the rules. So what I'm saying is this: the message I send to them, to people, is keep home safe. That's very simple. So if you're going to keep home safe, that means you need to know what your status is at all times. If you've been exposed, you need to know what it is, and that includes testing. You need to isolate when it's time to isolate if you're positive, and you need to be wearing a mask and keeping your distance as much as possible, regardless of what the CDC says, regardless of what the government says. Keep home safe. And that'll help a lot with all this foolishness. And that can mean vaccination or not vaccination. If you ask me, keeping home safe means getting vaccinated. But if you can keep home safe without being vaccinated, more power to you.
And I think I don't understand how you can just walk away after 5 days. Because what I'm starting to see a lot of adults who get colds, who probably have COVID, don't even get tested the first time.
Right.
And so that's one thing. So just to kind of sum this piece of it up, and I have one more piece on COVID, is you are exposed. You're a contact if you're within a person who's positive for 15 minutes, 6 feet, within 6 feet.
Mm-hmm.
That makes you a contact. Then you quarantine, unless you've been boosted or unless you have had a COVID within 90 days. If you test positive, I don't care whether you've been vaccinated or not, you isolate. You isolate for those 5 days. And I think, just like you think, you ought to be tested at that time to make sure you don't have the virus anymore or you're not spreading it. But the CDC doesn't say that. And I agree.
Well, the White House is going against that, because they have bought 500 million and in the process of buying 500 more million tests. So that's 1 billion tests that they're trying to put out there. So that sends a message that testing is just as important as isolation.
Yeah, but the tests won't be there because the pandemic is already starting to wane in parts of this country and other parts of the world. The estimate is that when the tests come, the particular crisis will be over. But I agree with you. I mean, you can't look at that CDC. So you got to listen to us. You listen to us, because we'll tell you exactly. If I'm in isolation, I want to know after 5 days, do I still have the virus? And if you're symptomatic, you stay where you are. And if you have the virus, then you isolate for 5 more days. And I keep
Well,
them
the
on.
5 days is coming from this. And this is what one of the things I learned yesterday. The 5 days is coming from this. When you get exposure, your most contagious period is the 2 days,
Right.
and then 3 days, like two,
Right.
2 days prior to you showing symptoms.
Right.
Right. So 2 days prior to you showing symptoms, you could still be spreading it and not know it. And then the 3 days after you start showing symptoms,
Right.
you're also very, very contagious and can transmit. Yeah. So that's where the 5 days, the 2 and the 3 came with the 5. And so after that, they're like,
but the 5
vaccinated is pretty safe. But
I just on their site, they say the 5-day period starts when you get the positive test.
Yeah.
And so,
but anyway, I'm like this: if you are positive, if you have a positive test,
right,
I would isolate, mask, and watch my distance and wash my hands until I have a negative test.
I agree.
That's where I would.
And now this is the Doc and Dean philosophy. We're not the CDC, exactly. But look, we're not the CDC, but we're Doc and Dean. The other thing is that one of the discouraging things is older Black Americans are lagging way behind in getting that booster. And that booster jacks your immune system up tremendously. So I think that's one thing that we really need to consider. And we may run a piece a little later than that. But that's the Doc and Dean, and we're sticking to it.
Absolutely. But there are some other challenges to our health conditions. And one of those challenges is air pollution. And so as Black people, we understand the history of redlining in this country. We understand how we have been forced to live into areas that aren't the best with regards to the environment. That's close to roadways. When they started building the state highway systems, somehow those highways went right through Black communities, sometimes directly through Black communities.
And so right through downtown.
Right through downtown. A lot of air pollution happens as a result of that. When you have the airports that are normally built in areas around areas that have high Black areas, low Black, property values and whatnot. So air pollution is a significant issue when it comes to it, especially you as an asthma and allergy specialist. You had a recent interview about air pollution. Could you share some of those findings you had from that interview?
I can do more than that. I can share some of my original research. We did a study in San Francisco, and we looked at areas of San Francisco measuring air pollution in those various areas. And it's very clear that there are certain pockets in the Bay Area where you have higher incidences of COPD and asthma, and they correlate with the amount of air pollution. We found that Black communities and brown communities are located closer to the freeways. They're located closer to these plants. We got some stuff down there in Richmond, some of those big gas plants. I mean, you can just walk out and put stuff on your table and cook your food because of the radiation and stuff coming from those plants. And periodically, those plants go bad, and whole communities are threatened. So, and one of the problems, and one of the things I found out when we did some programs on environmental health, there's not the general interest in environmental health in our communities, even though we're probably more impacted than anybody else. You say global warming in the Black community, you don't have that many people who are engaged in the situation, but there's no doubt in a recent study that was published in the Journal of Allergy and Clinical Immunology shows that African Americans, people of color, are consistently exposed to more air pollution than any other ethnic group. And that's from my original research. Did I say that?
Yeah. You said, you mentioned that. You mentioned that it was from your original research. All right. So I think when we're talking about those things, and so when we see the movement, right? So we have to think about how our communities are formed and shaped, and that we also have to be better advocates with regards to when companies try to find areas to build these processing plants that put a lot of pollution into the air. We've got to be at those city council meetings. We've got to go in there. We've got to say, no, we do not want that in our community. And we have to have the votes to be able to say, if you vote to put this this plant in our community will vote you out of office. And so that's how these situations are interconnected, because these companies come in and they say, well, we're bringing jobs. And then the city officials say, yeah, we want you to bring those jobs to our city because we want to have employment for our citizens. And they say, well, where do we want to put it? Well, the plant puts out a lot of CO, all this stuff into the air. Well, we'll put it in these communities where there's not a lot of pushback. If you give them the pushback, they will have to stop, or they will have to find more healthier ways to produce whatever they're producing.
And one thing I would have to congratulate the people of Oakland, because in West Oakland and in Richmond, these areas where they have these plants, they are pretty well organized. But and so because they're threatened, these plants have blown up two or three times, and then when the freeway collapsed, here during the earthquake, it really revealed the fact that those areas were consistently bombarded, and the disease incidents show that. Mm-hmm. So in any event, I think that's something that we want to deal with as we go forward and try to get some more people, try to get us all more invested in the environment and certainly in air pollution in our communities.
Well, segueing for that, I think that's we're talking about things today that we don't really think about as much because it's not on our typical radar when it comes to health and wellness. This next story in this interview that I had is just one of those things. Because when we hear heart disease, we typically think about men. And it could be the result of our patriarchal society. I don't know. But when we think about heart disease, we typically think about men and high cholesterol. However, heart disease is a top killer of Black women, and it is a significant issue with Black women and in our community as a whole. And so I did an interview with a CEO of a women's advocacy group called Women's Heart, as well as their patient advocate, who is also she had a stroke, a survivor. And so I'm going to play this interview for you so you can kind of get some more information with regards to women, Black women, and heart health. Hello. We have a special conversation to have today, so I'm just going to jump right in here. The COVID-19 pandemic has brought disparities in healthcare to the forefront, especially among people of color with or at risk for chronic health conditions, including heart disease and stroke. Here to shed light on those inequities and to explain what we can do to help stop the rise of deaths from cardiovascular disease, or CVD, are Selena Goree, Chief Executive Officer of Women Heart, along with heart attack and stroke survivor Shanta Quillette. Welcome to you both.
Thank you.
So first question for you, Selena. Why are we seeing a rise in the number of deaths from heart disease and stroke, especially among certain groups?
Yeah, so cardiovascular disease, or CVD, which does include heart disease and stroke, makes up about 1 in 4 deaths, making it the leading cause of death in the country. In addition, nearly half of all adults suffer from some form of CVD. Now, as you mentioned, certain communities are at a higher risk. For example, Black Americans are 30% more likely to die from CVD than other groups. And Native Americans are more likely to die prematurely from CVD, meaning die before the age of 65. In addition to that, numerous groups struggle to get good health care, which means that their health takes an even greater hit, besides sort of the risk factors connected to background. And in addition to lifestyle issues like diet and exercise and sleep, other factors, for example, that's in a city center or in a rural area, may also impact your health directly.
Absolutely. Shanta Quillette, this question is for you. So you have been diagnosed. You are living with cardiovascular disease, or CVD.
Yes.
Tell us what led to that diagnosis.
So I never ever thought of myself as someone who would have any type of heart condition. I was young and active. 2012, I was running on a treadmill, started having some heart palpitations and some other symptoms, went to the doctor and couldn't get a clear diagnosis. Fast forward to 2018, I had my first heart attack, and about 9 months later, I had a stroke while at work, and I was given my diagnosis.
So what would you want others to learn or know from your experience?
Absolutely, especially my children and women of color, that we need to be very vigilant in our health. We have to, advocate for ourselves and be proactive, and we need to know those risks. And even our family history. For me, I didn't know about my family history till after my diagnosis. I didn't know that my mom had dealt with cardiovascular disease, and my father. Also, really finding a doctor that I could trust. I made sure now that all my doctors look like me, so they can understand me culturally, and then just making sure that we speak up, and we recognize the signs, and we're not scared to go to the doctor. A lot of times people don't want to go to the doctor because they think, oh, the doctor's not going to tell me anything. They'll send me home, and I say, hey, still go to the doctor. It's better to go to the doctor and they tell you nothing, but than to stay at home and end up in a casket.
Right, right. So, Ms. Gorey, one of the things we always talk about here on Black Doctor is helping somebody become their own best health advocate. And the way they do that is by knowing, so what are some of the things that people can do in order to advocate for themselves or a family member? Like in the case of Ms. Carter Williams, is that, she didn't know about her family history, which could have contributed. If she had known that ahead of time, maybe she would have been looking for, so we never know. But what can some people do in order to help be a better advocate for themselves?
Yeah, I do really want to reinforce what Shanta Collette said. Making your health a priority. As we come into the holiday season, work and family obligations are going to feel like a big strain, but that's not a reason to put your health to the side. You need to make sure that you're keeping your health sort of really at the top of mind. I want to reiterate the fact that having a good relationship with a doctor will really make the difference. And if you don't have one, find a doctor that you trust. And if you don't get along with the doctor you have, find a different doctor. That is all within your control. So that's really important too. I would also say know your numbers. Your blood pressure and your cholesterol levels are really good, strong tools to tell us how healthy our cardiovascular system is. So if you don't know those, there's a really easy and inexpensive way to know those numbers. You can go to the pharmacy, and get those numbers looked at. So making sure you know those numbers, that's really important. And here at Women Heart, the organization that I lead, we are partnering with Novartis. And what we are asking folks to do is to join a really cool campaign that we're working on them with called the LegacyWeLead.com. And if you go to that website and take the pledge, you'll have access to a ton of information, because what we want to do, Shanta Collette and I, is invite all of you to join this fight to stop this #1 killer of cardiovascular disease in our country.
Absolutely. Absolutely. So if you're watching this now or you're watching us later, you see us scrolling along the bottom. That's the website. Go to the LegacyWeLead.com. Make sure you register, get that information. If it's not just for you, it's for a family member. Share that information with your friends and family, because this information needs to be spread. So make sure you go to the LegacyWeLead.com and register there to get all that access to all that information. Last question I want to ask Shanta Collette. Day one, you're diagnosed with cardiovascular disease. What should someone do?
Hey, it definitely pulled me up by my lapels. And I truly started living life. I tell anyone, don't let it stop you. Don't let it be an obstacle in your life. Look at it as a new start and a new beginning. Cause again, you got a new chance. It could have took me out. It didn't. So start living and making sure you do what you need to do to make your health a priority. So, I listen to my doctors. I listen to myself. I make sure that I stay healthy, and I make sure that I eat right and do all the things that's necessary to stay alive, So, during the times before that, I often slack on, but now I know I can't do that because my health is at risk. And so I definitely want to be here as long as I can for my children and husband.
Great. I love it. I love that. Same question to you, Ms. Gorey. Day one, what should someone do when they're first diagnosed with cardiovascular disease?
Well, our belief at Women Heart is that women need women. And the reason that we're here is because the best thing you can do is reach out.
Okay.
We, as an organization, take volunteers who are women, just like Shanta Collette, living with cardiovascular disease, and pair them up with other women who are just starting out in their journeys. And I can't tell you how many times I've heard that, making that connection to someone who's been in the exact same place as they are now makes a world of difference. As they say, that their doctors saved their heart, but Women Heart saved their life. So it's a pretty ringing endorsement for peer support.
Well, I love to hear that. And I'm so happy that you all were able to take the time out and speak with us today. This is a serious issue, particularly in Black and Brown communities. And so we're glad that you are stepping up and stepping into that, be a leader in this area. So make sure that you go to thelegacywelead.com, register, get this information out, share the stories, get that information so we can continue to save lives. Also, eat right, go see your doctor, do your follow-up, and all the things that your doctor's been telling you for years, but you got to do it more so now. So again, thank you both for joining us, and we look forward to hearing more from you in the future.
Thank you so much.
Bye.
And we're back. That was a great.
That was a good. One of the reasons we talked about that today, which was a great interview and looks like a great organization, because women get it. When we talk about underserved populations, talk about unconscious bias. It includes people of color, but it also includes women.
Yes.
So they're very right about that. But there was a study done that demonstrated that African American men, who live in, houses like yours and places like, upper middle class neighborhoods, they are just as much at risk as men who live in other areas. And that's not true for any other ethnic group. A study was done, published in the Journal of Cardiology this week, that said that when they looked over across the spectrum of about 15 years, that the incidence of heart disease among Black men did not change based on socioeconomic status. And so those of us who feel comfortable that we've kind of made it, unless you pay attention to the same things that they're talking about, your cholesterol, your exercise, your weight, you're just as much at risk as if you had not jumped on the economic ladder. I want to just play one piece that we were trying to do on a more regular basis. It's a coronavirus update, kind of a 1-minute piece that we're going to start to feature, I think, on our website, and hopefully maybe we can convince Black Doctor to run it as well. Can I just hit it and will it play? If I just hit, no, the update. From this week's Journal of the American Medical Association comes an article reporting from 2 large studies that getting the booster after initial vaccination prevents very severe COVID-19 disease and death in 90 to 95% of cases. I'm Dr. Michael Noor with the Ethnic Health Report. Black Americans over the age of 65 are not getting this booster. This is a dangerous situation because older Americans are still at greater risk. Why is this important? We can't give up fighting this disease with everything we have. With evidence that booster shots are this effective, we've got to continue to encourage every eligible person to get one. So what are you waiting for? If you're fully vaccinated, get boosted. If you're not vaccinated, get vaccinated and then get boosted. This message is sponsored by the African American Wellness Project and the Alameda Alliance for Health. Remember, we're all in this together. So that's going to be kind of something we do 2 or 3 times a week. If there's news that we think the Black community needs to know, and try to run some of it as part of the program here. I think one of the things that piece illustrates is that, we tend to get pretty lax, and not realize that this virus is not progressing. And it is consistently trying to mutate. It looks like we may be on the downside. At least I get a sense this week there weren't as many patients of mine as last week of this pandemic, but there will be others. And if you're over 65, you're at risk. And so don't relax because you got vaccinated. Get boosted. Boosting really does a tremendous job, not necessarily in keeping you from getting the virus, but certainly keeping you out of the hospital and keeping you out of the ICU.
Well, absolutely. I think it's imperative. Again, I'm going to keep, this is my new mantra, is keep home safe, right? And so the best way and the most efficient way to keep home safe is by starting with being vaccinated, right? And so then we have to do other things personally in our day-to-day behaviors, where we go, interactions. I know you got those courtside seats at the Warriors game, so I know it's hard for you to
Well,
to pass up on those things.
And I'm not apologizing for it.
But in all seriousness, we need to do those things that are going to keep us, as safe as possible, and keep the people that we live with as safe as possible. Start with your home, work out from there. And then your community, if you have to go to work, if you're an essential worker, start with, okay, I got to protect the people that work around me. And then if they have that same mentality, then we can get through this pandemic. But if we start becoming more selfish, if we start looking at it from a selfish standpoint about what you want to do, what you don't want to do, what you don't like to do, or pointing fingers at the CDC and medical, they don't know what they're talking about, then we're going to have some issues, and we're going to continue to have issues surrounding this virus.
Well, I think this has been a good session, a good discussion. I think.
Thank you, Joel, for being vaccinated. 72. Joel said he's 72 and he's been vaccinated and boosted. So we appreciate that, Joel.
All right. I think that concludes our discussion for today. I think we'll be here every week with the latest news that we can find. If you can find something yourself, let us know. So we'll see you again next week. And remember, health is your biggest asset.